Okay. Oh my God. Okay. Can you hear me?
Yes, can you hear me?
All right. Let me add you onto the screen. Oh my God. Okay. We are live. Hi, girl.
Hi.
Okay. You're a little bit blurry. Okay. We're just going to wait until some people get in. We got 4 people in here so far. Welcome, everybody.
Okay,
Welcome to
cool.
the live. Oh, wow. I'm going to set up. Um, If you are in this live, drop in the comment section. Perfect. I can hear, can see. Okay, great. All right, let's get a couple of people into the live. Yeah, the ticker. Okay, who else? We got 5 people in here so far. Everyone's coming in. Welcome, welcome, welcome to our live. I'm so excited to actually have this discuss this today. We're gonna wait until a few people get in, and then we're gonna start. Okay. In the meantime, let's
Okay.
play the intro. Welcome everybody to Big Girl TV. And for those of you who are listening, welcome to the podcast, which would be Big Girl TV. I mean, the Big Girl podcast. Wow. Guys, I am super excited to actually have this person on my live today. She's actually my cousin, people.
Yes.
Um,
Yes.
this is my cousin, guys, and the reason why I actually called her is because she actually is an expat, but she does not live in Panama. She actually lives in Spain. Okay.
hmm
Um, Before we get into the exact topic, I know you guys already know. If you don't know what the topic is about, this is actually about the reverse birth tourism. And for those of you who don't know what reverse birth tourism is, it's when people from America actually travel to another country to give birth. Let me fix my camera. Sorry. Okay, better. Wow, no, it's not. Okay, so it's basically when people travel to other countries to give birth. Now, I actually wanted to jump into this article before we get in. I don't know if you guys can see it. Let me know in the comment section if you can see the the article. Okay, I'm gonna share the screen. All right. So this article, for those of you who are listening in to to the podcast version, it's called the Reverse Birth Tourist. U.S. women seek cheaper countries, to have babies. Americans are choosing to have babies abroad to avoid crushing maternity and child care costs in the U.S. Last year, and I want to know that this article was written in 2020, so it's what, 2 years old? I think, yeah, 2 or 3 years old. Last year, more than 66,000 Americans had babies abroad. The government doesn't ask parents why they're overseas, but expats motivation surveys, migration experts, and interviews with over a dozen Americans around the world reveal that many leave home, at least in part, to escape the crushing financial and personal costs of starting a family in the United States. The U.S. has the highest child care costs. Sorry, guys, I'm going live on. I forgot to go on live on Instagram. Um, the U.S. has some of the highest child care costs in the world. Even Americans with employers provided insurance can expect to pay an average of $4,569 in out-of-pocket birth fees. In one of the high-income countries that doesn't mandate paid maternity leave and has longer work weeks and less paid time off than most other developed countries. The price of infant care tops $1,500 a year in some parts of the country and is expected to rise as a result of COVID-19 pandemic. This is why American birth migrants are seeking refuge from unique U.S. boarding in countries with either lower cost of living and um, more government support for parents. Okay, so if you're interested in reading the rest of the article, because I did not want to bore you guys with it, you can read more of the article. So there's two. This topic is actually a two-way topic, especially for women of color. Now, I know my cousin, she gave birth. I know it was crazy because, like, for me, for example, I had my daughter in Panama, and people were like, well, why don't you go back to the States and have your baby? Did you experience that?
Yes, yes. So can y'all hear me well? My headphones, I got the headphones on because it's a little late here, so I don't want to disturb everyone else. But just let me know, and yeah,
You're
I'll
clear, girl. We
continue.
can hear you.
Yeah. Yeah. So people would ask me that. And I think I gave birth in 2019. And I remember, I think maybe the year before, there was that big New York Times article about Black women dying during childcare,
Yes,
and people,
yes.
yeah, and so it was either the same year or the year before. And I remember that article, and people would ask me, Spanish people would ask me that. I guess they were curious. What kind of got to me were like people from the States, like, oh yeah, so you're gonna have him in New York? Like, I'm from New York, and I'm like, no,
Mhm.
not at all. Like, I hope no, absolutely not. Like, there's no. I mean, people are like, oh, well, will he be American? I'm like, oh yeah, he'll get it. I can get citizenship for him. I'm American, so I mean, or North American if you're from the U.S. And so yeah, people would ask me that, and I thought the question was insane because for me it was like absolutely not, no, not
Yes,
at all.
girl. I know exactly what you mean because even with me having Gia, people were like, well, why are you having a baby in Panama? Like, you need to go back to the States and have your baby. And I'm like, you do know that she's going to be American. I think people were really just focused on the immigration process and the ignorance of the immigration process, that they don't know that you can have a child outside of America. As long as you are American, the child will have American citizenship. I'm glad that
Yeah,
you actually touched the whole topic about the maternal rate in the
yeah.
U.S. because that was actually what I was going to actually go to lead into it. But since we jumped into it anyway,
Yeah,
let's just
no. I mean, there's a whole conversation about like healthcare and how that system is broken, but then there's also a whole nother intersectional part of that, how it's like Black women and like what those issues are. So yeah, absolutely. Like it's
no, that's
all leads
definitely
one leads to another.
how do you feel you were treated? Because this obviously you only have one child, so I just want to hear your perspective. Because obviously, for those of you who are just coming in, because people are still coming into the live, if you are just coming in, we're going to save the live so you can catch the conversation on the replay. We don't want to keep. It's late where she is. She's in Spain. Okay, so she's in Spain. So for those of you who are on Instagram and you want to tune into this live, please tune in on YouTube so that you can comment. We're having an amazing conversation and we're just getting started. So log in on YouTube. All right. So me personally, I have two kids. One of my kids was born in the States. The other one was born in here in Panama. And there was obviously a difference. Okay. So I can compare the two. I'm going to let you start and let everybody know what your experience was like when you was giving birth in Spain. I don't know if you know about in the States, but what was your experience like giving birth in Spain? What was your prenatal care in Spain? Give us
Mhm.
all those details.
Yeah, yeah. I do want to start and kind of highlight that, I don't necessarily agree with, I guess, the article calling it a little bit of like tourism because I'm an expat and I do live here. And so one of the first, you get all these articles and all this media about, oh, health in Europe, it's free. And it's
Mhm.
not that simple. So I am a legal resident here. I'm an expat at work, which means I pay into the public system, which I am entitled to very low healthcare, right? And so just starting from that, it was great. So I will say here, I love the healthcare here, but I do think that it's something, when you have a major issue, there are some issues like with long waiting lists, but the quality of care is always top. And so pregnancy is considered something that's super regulated. It's super followed up. So I would say, so I guess I'll start with appointments. I don't remember how many times exactly I saw the doctor. I think there's 3 or 4 that are included in the public prenatal care. I was okay
Mhm.
with 3 or 4. That some people, like to see the baby every month, and that's also okay. But I was fine with 3 or 4 scans, no, like scans to see the heart rate. All of my testing was included: blood testing, genetic, well, not some genetic tests, like the one that they do at 14 weeks, I believe, to see if there are like any abnormalities or things like that. It was all covered, like 100%. The only thing I paid for were my prenatal pills. They prescribed iron pills, and those were like €1 a box. Again, because both healthcare and medicine are subsidized. And yeah, my experience giving birth, I think I liked it because it was a lot of, they kind of let you place a lot of trust on like you and how you feel in your body, which I also liked. I had a really positive experience. I did end up having a C-section, a little upset about that. I did all the things and read all the blogs and like natural birth, and I was at the physical therapist, and yeah, but that is another story for another day if we're gonna have a live on trauma. But so I end up having, I had a wonderful team. One of the things about the public healthcare system is that you don't necessarily know who your doctor's going to be. It's just kind of whoever is at the public hospital, right?
Oh,
Um, but that was okay for me. Like I didn't really have too much of an issue. So like I had my own doctor throughout the pregnancy, and I had one nurse assigned to me, like a nurse practitioner who would do checkups, and that and so yeah, the birthing. But again, it's the body of healthcare is so well that like, you don't need to worry that you're gonna get some person who doesn't really know what they're doing, right? In fact, I actually had a head doctor, and I had a couple of med students that were
hmm.
there kind of attending. They let me kind of try and birth naturally as much as possible. There was no pressure at any point to get a C-section because they are very much, they do try to push or let you birth as naturally as you want to. I wrote a birth plan. They followed
Hmm.
it as much as possible, as much as they could. That was my experience in one maternity hospital. I don't want to say that this is all in Spain. One maternity hospital in the south of where I live, and it's a public hospital. So I will say, I know the experiences can vary, but mine was very good. And generally, I think in circle, people say that the service is very well. I mean, but even, and I know this. I've been living here for a long time,
How
and I
long? How long?
knew that it wouldn't. I've been here for about 14 years. And I
Wow.
knew, yeah, and I knew that healthcare was cheap, but I still kind of like expect to walk out of the hospital like, they got to charge me something, right? Like I got to get a bill for something. I walked out with a
How much did
baby,
they charge you? How much
blankets.
not to be in
They
your
didn't
business,
charge
but
me
how much
any,
did
didn't get charged anything at all. I mean, again, I pay into the system. We do have hefty taxes here, yes, but I pay into the system, and that was it.
so
You
basically, if you
know,
pay in the system, if you pay your taxes, that is, in Spain, and you give birth, you don't pay.
I did not pay. No,
That is very interesting. And you said the public health system wasn't that bad, but when you did your prenatal care, you did your prenatal care with one doctor, right?
yeah, yeah, with one nurse practitioner. For the ultrasounds, so you go to like the big again, the big public hospital for your ultrasounds, and then you would see, I guess, various people, again, whoever's on duty at the hospital at the time. And so I will say that maybe that a lot of people, I know that that's a big, like that a huge negative, like a drawback, like you necessarily have that personalized one-to-one attention throughout the pregnancy. I was okay
Hmm.
with that. Like I was fine, I have full faith and trust in the system, in the public system here, so I was okay with that. But I do know that many people do go private because we do have private healthcare here, and you can pay into that, and that is a much more personalized experience. One doctor, one person attending, or one nurse practitioner, and like the person that you're going to give birth with, ahead of time.
So, what made you actually choose to go public versus going private?
I don't see the need to pay into private healthcare if I'm already paying by virtue of employment to a public healthcare system that works for me in my current period of time where I am in life. And what I mean by that is I'm young, I'm relatively healthy, I don't have pre-existing conditions, so it worked me, the public healthcare system. I would, I know if you have like maybe something a bit more serious, like maybe you had a friend who had some fibroids removed, but she was on a waiting list for a really long time, and she had to get her doctor to advocate for them to put her up. So again, if you do have an issue, there may be some reasons why you might want to move into. But if you really don't have any issue, I personally don't see the point in paying for private healthcare.
One of the things that I did notice, like being with my pregnancies, because obviously I have two different kids. I have two kids, and one was born in the States, and then the other one was born in Panama. And I know that with me, I can compare my pregnancy experience and what I do realize in Spanish countries or Latin American countries or countries other than outside of the US, they take pregnancy or pregnant women very, very seriously. Like
Yeah.
here in Panama, pregnant women don't wait online for anything. There's special parking for pregnant women. People treat you with respect. Versus in the States, when I was pregnant with my son, I literally would get on the train, and then when I would get on the train, men included would look down so that I wouldn't. They didn't have to offer me a seat. I would usually get offered a seat from females, but I think here what I experience is that there's a certain respect for pregnant women. Do you think that you have the same experience, or is it the same thing in Spain?
hmm I mean, yeah, for sure. People were, throughout the pregnancy, very, very nice. I guess I didn't have the public transport thing because I didn't really use it too much when I was pregnant. But I mean, yeah, it's people like children a lot here, I think, and I think that it's not necessarily so much,
Yes.
because there are issues of, you know, misogyny and like pay gap, and I think it's just that it's a culture appreciates children a lot, and so kind of place a really high value on pregnant women as like bearer of the fruit, if you
Yes.
will.
Yes.
And
Yes.
so I think there was a lot of that going on. But then again, I also think that here, and again, I'm in the south of Spain, people are more open, a little bit more friendly, and like very much like, oh, hey. Now, I will say that friendliness got into a lot of unwanted touching, placing the hand on the stomach. And, again, I've been
Yes.
here for a while, but I'm from New York, and I'm like, please don't touch me. But yeah, people were very, very nice throughout.
So we have a comment from Y War 1986. And he says, people just prejudge you if you have disabilities and say you didn't have to sign a paper that were not coerced into surgery to have either your tubes tied or permanently unable to have kids. He also says, have you ever heard of issues like that in either Spain or in Panama? So I'll let you go first.
I'm not okay, so I'm not sure I completely understand the question again. It might just be me. It's very late here. um,
Let me put it back up.
so
Can you see it?
yeah, yeah. No, yeah, and I can see it in the chat.
Okay,
I don't know
okay.
if yeah, if why would they possibly comment again and maybe like clarify a bit because I'm not sure what the question means, and I do want to make sure that I answer it to the best of my ability.
So why War 1986? I think that's Warren. Could you please clarify the question? He did actually write something else. He said, I feel that would happen to me as a person with disabilities, that people would prejudge me and say I would not have to sign a paper confirming that I not coerced into that sort of type of surgery. Um,
I mean, if you're talking about, I guess maybe C sections and natural births, or like I'm trying to read through the lines, and I guess I'd rather wait for a little bit of a clarification, and again, I want to be able to answer to the best of my ability. So if you are in the room, please, let me know exactly what you mean by that question, like in terms of pregnancy, in terms of birth,
Yeah,
healthcare.
I didn't get that. I'm gonna assume that. Okay, he says, sorry, I meant in general of people with disabilities. So people with disabilities will prejudge you. If you feel that people will prejudge you because you have a disability and say you did not have to sign a paper that you were not coerced into surgery. Okay. Can you write that over, my love? I'm referring in terms of having children.
Right. So if the experience would be different as a person with disabilities, like like
Okay.
childbirth or pregnancy, or I not speak to the experience of a group or an identity which I have. So I'm not like, I don't want to say like, I know I have the correct answer to this, but I would say that people with disabilities are treated same way as anyone else, right? In public healthcare in terms of pregnancy, prenatal, and birth. If it is the disability that has the potential to interfere, and I'm not that's the right term, with the pregnancy, then I would say it would be treated even better because, for example, if you have what's considered a high risk pregnancy for any reason, then you get more scans. You see the doctor almost every month, right? And they're a lot more, rigid with your pregnancy. So I think that I don't think that a disability would kind of exclude you from any sort of quality healthcare in the public system.
For me personally, I did not have my baby in a public sector. So I'm not sure what my experience would have been if I had my daughter in a public hospital versus me going private. But I will say in the private sector, I am over 35. I'm over 35, but less than 40 years old. So just put that out there. Okay. And usually, so with me, because I was over 35, because initially I was going to have my baby in the States because everybody told me to have my baby in the States, right? I did start out my prenatal care here in Panama was because I found out that I was pregnant in Panama, right? So like in December, when I was like I think like 4 or 5 months into my pregnancy, I did go back to the States. And I went to one of these prestigious hospitals, okay? It's supposed to be a prestigious private hospital, okay? And the doctor really treated me funny because one, because of my age, and two, because I was Black, okay?
Mm-hmm.
She basically
Mm-hmm.
said to me, and it was so crazy to me because my experience was the total opposite when I came back to Panama. So she basically wanted to give me baby aspirin. If you know me, you know that I'm very active. I work out, I eat right. So there really was no reason for her to put me on this so-called medication that she wanted to put me on. So she's like, okay, well, and first of all, she was just rude, okay? She's like, okay, well,
Mm-hmm.
are you taking baby aspirin? And I'm like, no. Well, I'm going to put you on baby aspirin because you need it. And I'm like, why do I need baby aspirin? Oh, because you're Black and you're over 35. And because you're Black and you're over 35, you are at high risk for preeclampsia. And I'm like, but I don't even have blood pressure issues. You don't know you never took my blood pressure. You never asked about my medical history. Like, literally know nothing about me and just assuming that
Yeah.
because I am over 35, that I am going to have preeclampsia. And then on top of that, her bedside manners was very disrespectful. And I literally was like, I'm going to get out of here because if I stay here, I'm going to knock this woman out, right? So I ended up coming back to Panama and continuing my prenatal care in Panama. And when I got here to Panama, it was so crazy because my doctor was like, well, why would they give you why would they give you baby aspirin? Because if you take aspirin, it's going to thin out your blood. And God forbid you have an emergency, that could actually
It's not
go.
great.
Yeah. So instead of them giving me aspirin, they gave me vitamin D with calcium, I think it was, to help me so that I would not get preeclampsia. So I had vitamin D with calcium. I had DHA pills, my regular prenatal pills, and then towards the end of my pregnancy, because I have I have a low blood count, they gave me iron pills to take. And that was the complete opposite from my experience in the States, which made me all the reason why I decided to just stay here in Panama and just have my baby. Amazing Oski says doctors in Panama usually prefer the natural way, which is true. but the doctors really take care of moms and baby. And in the end, if a C-section is best for both, they will suggest it. He also says, my son was born in Paithia Hospital and my ex-wife had the best care ever. Although we had options to have the baby at Gorgas Hospital, we chose not to. Mainly because in Panama hospitals, they see no color. And that's the thing. Like, I know for me, my personal, I think Panama is just a very classist country. Okay. It's basically the have or the have nots, if you ask me. If you black and you have it, you're good. If you poor and you're white, it's more like a classist versus racist. I'm not saying that racism does not exist, because racism exists everywhere. Okay, there's no place in this world where you're not going to have ignorant people. Ignorant people exist in all parts of the world. But for me, as far as my medical experience here in Panama, and I can compare the two with my son and my daughter, if I would have known better, I would have had my son in Panama too. My concerns were heard, which brings me to, okay, this article, which I think it is pretty much exactly, I didn't know it at the time, but now that I am older and I have a child, I actually can understand and see why people treated me the way they treated me when I had my son. So in this article, this is an article by the CDC, okay? And to think that in 2002, we're in 2002, right? I think we're in 2000. What year are we in? 2002, whatever.
2022.
In this day and age, we're still dealing with racism in healthcare, okay? Everybody wants to move to America. Congratulations, but the world is huge. And there are other places in the world besides America, okay? So on April 6, 2022, the CDC put out an article saying, working together to reduce Black maternal mortality. For those of you who do not know what is Black maternal I can't even speak English right now. Black maternal mortality is basically, there's a huge crisis in America with women dying, a Black woman dying while giving birth, okay? Either prior to or postpartum, and before, or children dying, okay? So I'm gonna go ahead and read this article briefly. It's a short article. I think it's a short article. Well, no, it's actually really long. But I'm gonna read the major parts of the article. I'm gonna leave the rest of it in the description box. So for those of you who are tuning in and wanna go back to read the article, you guys can read the article. So it says, Black Maternal Health Week is recognized each year on April 11th to the 17th to bring attention and action to improving Black maternal health. Everyone can play a role in working to prevent pregnancy-related death and improve maternal health outcomes. And it's sad that this is even a thing, right? So most pregnancy-related deaths are preventable. Each year in the United States, about 700 people die during pregnancy or in the year after. Another 50,000 people each year have unexpected outcomes of labor and delivery with serious short-term or long-term health consequences. Each pregnancy-related death is tragic, especially because 2 in 3 of them are preventable. Recognizing urgent maternal warning signs and providing timely treatments and quality care can prevent many pregnancy-related deaths. Racial disparities exist. Black women are 3 times more likely to die from pregnancy-related causes than white women. Multiple factors contribute to these disparities, such as variations in quality healthcare, underlying chronic condition, structural racism, and implicit biases. Social determinants of health prevents many people from racial and ethnic minority groups, meaning Black and brown people, so Hispanics are not eliminated from this, having fair opportunities of economic, physical, and emotional health. Pregnant people and their families can talk to healthcare providers. Okay, so this is basically telling you what you can do. So I actually the reason why I'm even talking about this is because I noticed that when I was pregnant, and now that I'm in my 30s, I didn't realize that then, but I had my son in my 20s, right? I had no idea what I was experiencing. I should not have been experiencing. I was in so much pain, okay? And I know with childbirth, they say that you're supposed to be in pain, but the amount of pain that I was in was absolutely ridiculous. They told me that I wouldn't violate and that I had to have a C-section, right? They told me that I was scheduled to go into my C-section at 10 o'clock. Girl, I didn't have my son until 2:30 the following morning. Okay? And the reason why I didn't have my son till 2:30 the following morning was because number one, they felt like I wasn't in that much pain and I could handle it. Number two, they claimed that they had 2 emergency C-sections that was more important than mine. It just so happened that those 2 people that went in before me was Caucasian. Okay? The only reason why I know that is because I seen when they drove past. Okay? When I got out of my surgery, no one told me that with a C-section it was going to be so painful. Okay? It was so painful, right? They put me in this room, a dark room. I had so much gas, okay, ridiculous amount of gas. And I had to ask my son's father to please get me some tea because nobody would not. I'm like, I'm in so much pain in my stomach. I got so much gas. Can somebody please get me something to break the gas? No one paid no attention to me. When I went to recovery, right, that's when I was in recovery. When they finally got me in a room, they put me in a room where they kept old people who were in hospice. Okay? That is where they put me. And I'm saying to myself, well, why would they put me here? But I didn't know no better. When you don't know no better, people do whatever the heck they feel like they want to do. Okay? I think when it comes to women of color, I think that people automatically assume that we can handle a lot of pain. Okay? That for some reason, Black people have this immortal pain, tolerance for pain, so that when you do say that you're in pain, they don't believe you. When I had my
and
daughter,
it's not even. But the thing is, though, it's not even that like there's this perception. The medical field for many years propagated like they researched about how the Negro women felt less pain, so and did experiments on Black women, right? Especially like for uterine for feminine care, and like that belief was like accepted scientific fact. So it's not even like people think this is a study, or these were studies that were like generations to the medical community that are just now being dismantled. Like this assumption or this like thought or this finding that people of color experience less pain.
exactly. I don't want to ignore the people that are on live. T Law Girl said the same thing happened to me. 2 Jewish women went in before me. See, this is not a thing. Versus when I had my baby, they were advocates for me to have a natural birth, right? I was in labor for too long. I wouldn't open again. I still had the same dilation problem. And I was just like, you know what? I'm just over this. Just give me a C-section. Because the doctor was like, well, why don't you want to have a C-section? And I told her, I was like, the last time I had a C-section, I was in so much pain. It hurt so bad. And I didn't want to go through it. And she was like, girl, calm down. You're not, and this is in Panama, okay, where everyone feels like this is some type of underground country. She said, girl, don't worry about it. You're not going to feel
Well,
no pain.
if you got money in Panama, then you Gucci.
Exactly. She's like, girl, trust me, you're not going to feel any pain. You're going to feel good. And let me tell you something. My recovery process was so amazing, which I personally was in shock because the following day I was like walking. I remember after having my C-section and I came out the hospital, I could barely walk. Like, I'm like, that was not my experience having my baby in Panama. The experience was completely different from what I experienced. Guys, if you are on Instagram and you are tuned in, please join us at BGirl TV on YouTube and comment there. Let me get to some of the comments before we jump in. Let's see. Okay, so Way War 1986 says, yes, I was referring about that. It never happened to me, just me just trying to see if, in general, if you heard of a person with disabilities wanting to have kids and were told they would be crazy to have one. Um, he also put, I took too long to type. LOL, you guys already answered my question. Amazing Oski wrote, and the article is true. For those who do not live in the States, they may not understand the struggle of women of color and the mortality rate. Yes. One of my subscribers was like, why do you always talk about race? Why do Americans always talk about black? If you lived in America, you would know that everything is about black and white. Period. That's what it is.
And also, I mean, if you live anywhere in the world, it's it's one of my mentors always says it's not the word, it's the phenomenon, right? So like, yes, America it says black and white, but like when you go to the slums around Paris, like who lives there? Go to the slums or in certain areas in Argentina or in Brazil, who lives there?
Exactly.
They're
Exactly.
brown. They're of a hue. You know what I mean? So like it doesn't have to, like I think people from other places use that as an excuse to not confront the system of oppression that they have in their own countries. So they'll say,
Exactly.
oh, that's such an American thing. Like, oh, you Americans are obsessed with race. And it's really like you just haven't examined what this word looked like in your own context, but it's there. If you
It's
look,
definitely there.
it's
Definitely
there. It's
So Wayward 1986 says, that reminds me of what they say about people with disabilities. Two, yet they would rather not have any classes for teaching people with disabilities on how to take care of their children and their newborn. Um, Amazing Oski says, that would have never happened in Panama, which I said that is true. Same in that article goes for people with disabilities. I'm not sure if there's anyone to confirm this for me. So, oh, you said in general speaking. So, what is it like? People with disabilities try to have children, and they're like, I don't like what exactly happened. I
yeah,
know
I
it's not.
think so I think they're talking. I think why 1986 is what they're saying in terms of like prenatal care isn't just when you get pregnant, right? It starts with trying to get pregnant, right? So I think that they're referring to maybe at some trying to get pregnant and being discouraged from doing it because of the disability. And again, I can't speak for this
I
person, but
got
that
it.
I think that's what I'm understanding. That's what I'm
I get it
understanding from the comments.
because I would assume they would say or they present it like, well, we don't think that you should have a child because the child may be born with the same disability. So I think that's what he is referring
Hmm.
to. Amazing
Hmm.
Oscar says the doctor we have was into his patients. We have his on-call number, and he will answer our calls at any time of the day to ensure that mom and baby were okay. I personally, with my daughter, I got every time I went to the doctor, they did a sonogram. Every time.
Yeah.
Check
Yeah.
heartbeat, did sonogram. He had like this high tech 3D imaging thing. So I felt like
Mm.
good. Okay.
No, and I mean,
Wayward.
again, I'm sorry. Yeah, no, I mean,
Oh,
I'm
no,
sorry that you had that experience
oh,
with your first C-section. And to be honest, I don't think that that would happen anywhere in Spain. I mean, I guess I'd like to think that, but after again, they were the same way with me. Like they were really, I was pushing for a natural birth, and they tried everything, including an oxygen test that they do of the baby, which is a little bit invasive, right? But like just the desire, like they would really prefer natural birth, but it didn't happen. It happened to be a C-section, and so they wheeled me down to the recovery room, and it's you just kind of hanging out in there in the bed. They hook you up to a little button, and so every couple of minutes it just gives out a little bit of morphine, and so you're not like lying there writhing in pain. And
yeah,
yeah, the nurse would come in every couple of minutes to check on you. And I mean, yeah, it was fine, and it seems humane that they would just let people be writhing in pain before administering something, right? And it's insane.
it is. Um, so Wayward 1986 says in the US they always talk about Hispanics too, Latinos and Latin immigrants too. They talk about them in what sense? Like as far as childbirth is concerned. I think that there should be a class to teach people with disabilities to take care of their children. Um, I agree, but are we talking about in Panama or are we talking about the U.S.? I will say this though. I will say this. When it comes and I don't even remember what my train of thought was, girl. I'm getting old. I'm getting I'm getting old. Um, oh yeah, so back the topic, well not the topic, but basically like I just feel like my birthing experience here was super amazing, and I think it has a lot to do with I think Spanish countries, Hispanic countries, they believe a lot in family. Family is super important in a lot of these countries, and I think that that plays a major part in with the whole childbirthing experience too, because for some reason, I'm not even gonna. In America, it just seems like they're okay with broken families. Like they would rather broken families. I'm not saying that you should stay with someone that's in an unhealthy situation, but I do think that the importance of family is super important. And like when we were growing up, our family was just super close, right? Something
Yeah.
completely
Yeah.
different from what I experienced in American cultures. Like I have friends that are just straight up American and they're like, wow, your family is like really different from my family. Like you guys really get along. Like you guys are really like a unit. You
Mm.
guys hang out, you guys do this, you guys do that. So I think that also plays an important part in the whole childbirthing experience indirectly. I also think that that also plays a major part. Guys, if you are on Instagram and you want to comment, please log on to YouTube and search V Girl TV and go live, or you can go in my stories. The link is directly there. You can click the link to come in. We are talking about American women going having babies abroad. Another thing that I realized is that for some odd reason, I don't know why people. Well, hold on. Wayward said, all countries, it would be a great idea. B girl, I'm sorry you had to go through that for your first birth experience, but glad you had an amazing experience the second time in Panama. Thank you. Like I really did. So you have the baby. What is the postnatal care like now? Because that's also something important, the postnatal care. My
Mhm.
experience when I
Mhm.
had Amir was you go for your checkup, boom, boom, boom. Okay, fine. They don't really do in a whole like a real diving deep kind of examination after you have the baby, right? So, what was your
Mhm.
experience
Mhm.
like in Spain with aftercare with your C-section?
Mhm. Mhm. Yeah. So now I after is you when I got like staples done. And
Hmm.
so I saw the doctor maybe a couple of times afterwards. I guess one to kind of see how the scar was healing, and then another to take. So they took out my staples in two appointments. So
Hmm.
one to see how it was healing, and then she took out half of them, and then she decided that she wanted me to have them in a little bit more, and for another appointment, and she took them out. Now I will say that all of my kind of C-section, postpartum, and also prepartum care, like the scar healing and me not having any issues down there is really due to my physical therapist, and that is private, right? That thing that Spain is lacking in. I think many countries lack in the like some sort of postpartum
Yeah.
partum physical therapy for
Hmm.
women, and not just for C-sections, for vaginal birth as well, right? I mean, that whole area just gets all crazy when you start squeezing things in and out, right? And
Yeah.
so I do. So all was private, right? All that I paid out of my own pocket, but my physical therapist has a very reasonable rate. It's about 40, I believe, 40 euros per session.
What are your
And I
in
go to him,
US
and we
dollars?
do. Right now, it's they're one to one, so it's
Oh,
$40 right now, right? Because Europe and the U.S. dollar is the same, but yeah, and I recommend that to anyone who could afford it, right? And then again, this is the kind of goes back to our even original conversation in the article about this being a healthcare issue, the way that healthcare is allocated, and the way that healthcare is profitized in some places, the way that it isn't in others, right? So, if you can afford to pay for physical therapy, then you'll be fine. But not everyone can, right? Not every woman in Spain can, for example. And so there has been a push lately, I think, to include physical therapy and kind of some postpartum care, but I think they're a long way off, I think, to be honest.
Do you think that they're actually going to go ahead and go through with it in Spain?
I think it's a long way off. I think it could happen for sure, but I don't think it's going to happen today, tomorrow.
Yeah, okay. I don't think so either. I think that they should definitely have. That's actually a good point. The whole like post care is so important when it comes to birthing, especially if I feel like especially when you do have a C-section. So Quadash says this hit home for me. I had a C-section with my first, and the doctor messed up where I was bleeding out internally. If my husband wasn't advocating for me, I would have died. Let me tell you how advocating for yourself is so freaking important. A lot of times people try to play you, especially like doctors and stuff. They will try to play or try to like disregard. I'm talking about play. I forgot I'm not in Brooklyn right now, right? They will try to disregard a woman, especially Black women, and their feelings regarding their health. I shouldn't say only Black women because I did see an article about a girl who had breast cancer and they didn't want to give her mammogram, and then she ended up having cancer. We know our bodies. You can feel when something is off. You know when something is wrong. You have to be able to speak up. If you have a partner, you got to push until you cannot push anymore, because at the end of the day, doctors are still human beings, okay? They're still humans. They are not some magician, okay? They will make mistakes too. And sometimes you're overlooked because of stupidness, like the color of your skin. Like they think that we can bear this magical pain where we can't. So advocating for yourself is super important. And I'm not only going to say in the States, I think everywhere in the world, you need to advocate for yourself when it comes to medical. We were just so lucky that we've had really good experiences having children outside of the US. And I like this conversation because you are not a lot younger than me, but you are younger than me. So your experience, you can tell your experience, because like I said, they told me I was 35, I was over 35. So this, and this was going to happen to me. And none of that happened.
Yeah, what they call a geriatric pregnancy, which is the rudest term that I've ever heard.
And my experience was A1. I found out that I had when I went to the States, okay, and this is back to, let me read these comments before I get into this. I don't want to forget. Just remember what happened. I'm going to just remember blood clots, and then so just in case I forget. Wayward said, I have not had any children yet. I hope to have some someday. When I have a stable job and stable enough to have children, it's nice to hear both of your experiences. Thank you. Kodash said, I had a home birth for my second, and when I went for his checkup, the doctor called CPS on me and told my husband we're having our next child out of the. Oh, you told your country you're having it. Why would they call CPS for you for having a home birth? That is crazy. I'm so sorry that happened to you. Like, what? Wow, Kodash, I can't believe, but I believe you. So,
but it happens every day.
Oh,
unfortunately.
Why do they call CPS on people if they have home births?
To start, if spaces have it, it's not legalized, and I don't think that it's right that it's not legalized. Like, I think that it's people's choice, basically, to do what they want with their bodies. But yeah, sometimes if it's in a state where it's not legal, but then again, let's let this person kind of elaborate if they wish to share. And in the meantime, we're going to talk about blood clotting.
Yes, let me just play this little commercial break because I got to play this. I got, this play to build. Okay. So I'm just going to play this little commercial break and then we will be back. 30 seconds, guys. I'm sorry, but I got to do it. Okay. 43 seconds, actually.
The Image Boutique is located in the Centro Comercial de los Pueblos Mall, located in Panama City, just 15 minutes away from Tocumen Airport. We specialize in hair care, wig extensions, and much more. Come visit us.
Okay, so I am back. So this is what I wanted to say. So when I went to the States, so I left, I had my baby in March. I did my checkup. And then I went, and I'm getting real personal here, okay? This is probably TMI, but we gotta talk about it. And I went to the doctor to have a regular, what's the word called? I went to the doctor to have a regular and a physical, because with my insurance, you have to do a physical every year, right? So I did my physical, and then I was doing my physical, and it just so happened that when I was urinating, it was like blood in my urine. So I go see a urologist, went to see the urologist, so she sent me to get a CAT scan done for kidney stones, because that's one of the symptoms for kidney stones. When I went to go get the CAT scan done for the kidney stones, I discovered that I had a blood clot it was ovarian thrombosis, which is blood clot in your ovaries, your ovarian vein. So, okay, bye, have a good day, Wayward. So I made an appointment. For a urologist. Okay, now this is thrombosis. Okay, they're like, oh my God, this is emergency. Like the doctor who's giving me this, she said you need to go to the emergency room. Mind you, the urologist never called me back. She never called me back to talk about my results and what her findings. So this like 3 weeks went by. 3 weeks went by. So I was the one who read my own my results, and because I couldn't read, I work in the hospital. So I'm like, oh my goodness, this is thrombosis. Like, what the heck is going on? Went to go get my physical. I emailed the doctor, urologist, texted the urologist. She never replied to me, child. Never replied. When I went for my physical, my doctor, who happens to be a Black woman, she read my chart and seen that I had thrombosis, and she said, girl, you need to go to the emergency room right now. And I'm like, why? She's like, this could kill you. She's like, the urologist didn't speak to you? No one called me. No one said anything. Go to the emergency room. Then the urologist calls me, and she's like, yo, well, she didn't say yo. I don't know why they said yo. She's like, oh, I don't know why you're in the hospital. The thrombosis is not that big. I need you to follow up with a hematologist, because if you're in the emergency room, they're not going to do anything for you, blah, 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 blah. I'm like, okay. Waited for her to give me a hematologist number, because I don't know a hematologist. Homegirl calls me back literally like 2 weeks after that. Okay. I was like, you know what? One of my subscribers was like, you should go see this hematologist in Panama, because your experience is going to be completely different. Do you know, once I went to go see the hematologist, gave him the chart from this prestigious hospital. He read over and he's like, okay, well, you do have a thrombosis, which is a blood clot, but it's really not that big. So we're going to put you on, I'm not going to put you on blood thinners because you're breastfeeding. And because the thrombosis is so small, I don't think that it's going to cause anything, but we want to be safe. But when I think about blood thinners, this is how he's thinking. When I think about
like thinking out loud.
And when I think about feeding the baby, I prefer you give the baby breast milk. So I'm going to prescribe you this because it doesn't go into your bloodstream. And I'm like, wow, he really can't. Like, the level of care, completely different.
But I mean, again, it's all about, though, you are entitled, right, to that level of care because you afford that level of care, right? Like, it's thinking about the way that we use medicine for profit, and like the average person in the US, like the run of the mill, has some like basic insurance. They're getting that level of treatment at all because it's expensive. It's expensive for everyone involved.
This doctor actually works in the public sector. He actually, and a lot of these doctors that work in the private sector, they also work in public sectors as well. Because I don't know if
that's also the case. That's also the case here, whereby it's the public hospitals are always the best. So like they're the ones who hire and staff and train the best of the best, and but unfortunately, because of the public system, they don't get paid enough. Many of them do have to moonlight in the private sector, but it is the case here that they are some of the best. I have about 5 more minutes, and then I'm gonna have to cut out. It's a little bit late.
She's in Spain, guys, so it's like 1:00 in the morning in Spain right now. So we got 5 more minutes. Kodesh says, I live in Florida and it's legal. My husband is the first responder who is trained on delivering babies. The doctor was mad because I refused shots and kept pushing and asking me about my beliefs. Okay. And she says, I lied to CPS and said I was 20 and didn't know I was pregnant. And my baby just came out in the toilet. I seen a case about some girl in Florida that her baby got taken away for like both of her kids with CPS for like a long time. I remember that story, something similar to that. I do want to say this though. I understand that everybody has they have their choice with shots, but vaccinations here in Panama is it's a must. Like there's no literally like you cannot refuse vaccinations at all. So in that case, if you're going to have your baby in another country and you don't believe in vaccination, I would strongly urge you to research the country that you're going to,
I agree.
because other countries is not like America in regards of you being able to be liberal in that sense. Like America is a very liberal place. Like people fight for their rights, and certain things. I know that was messed up what the cops did to this person. I mean, to her, not the cops, sorry, the police. What they did to her, I think everyone should have the right to do whatever they want to. But I also don't think that going into another country is going to solve your problems if you are the type of person that you don't believe in vaccination. Just my opinion. Would you say the same?
Oh yeah, 100%. Like they not really kind of about that like here either in Spain. Like even with COVID, like if you didn't have a vaccine, you better have a damn good reason. And if you don't have a good reason, then I mean, we had like vaccine certificates. Some places you had to show it to get in, and if you didn't have it, then you just couldn't go. Like they're very much like not about like the free choice in that sense. The kids have to be vaccinated to be in the public system or in public schools or in schools, not public schools. Sorry, in schools, I believe in general.
Yeah. Well, you're welcome. That's what we're here for, to give you information, because that's the whole point of my YouTube channel. That's the purpose of me having these live discussions. It is to be able to provide people information that you cannot typically get in a sit-down blog. I think having open discussions with people are super important, because I think Black people have this thing where, don't tell people your business or keep things to yourself. And I think that's actually the wrong way of thinking, because if we don't share information, then people just won't know, right? So hiding things is really not the best thing. I don't think that at all. I think that having open dialogues are super important, because she experienced her story. This is actually going to be saved, and maybe somebody else that's going to see this on replay, or they're going to listen to it on the Big Girl podcast, they will be able to know how to maneuver. Okay, I think Florida is a special state. They do a lot of weird things in Florida, as far as especially to Black people, especially people that live a more holistic lifestyle. I've seen many cases in Florida with people who have children and live a holistic lifestyle that experience the weirdest and the craziest things.
Yeah. Now, and let me tell you something. In my opinion, if there is no abuse, straight out abuse, and if there is no drugs, and the best place a child should be is with their mother or their father, their parents or their family, who can take care of them. That's where they need to be. Like you take a kid out, you put them in a system for the system to chew up and spit them back out, and it's like they were just fine with their parents. They were just fine,
So I think this was an amazing discussion. For those of you who came in late, this is my cousin. Her name is Nisha, and she lives in Spain. She's an expat in Spain. I know you guys be wanting more information on Panama, but I feel like there's Black people and people that I know that live in places outside of Panama. My goal and my objective is not to try to get anybody or try to convince anyone to move to Panama. Only really what I want to do is to show people that there is a world outside of America. I'm not bashing America, because America has provided me opportunities to say the least.
Yeah.
However, the world is huge. The world is a big place. You don't literally have to be subjected to just one specific country. That's number one. And number two, to show that there is life outside of America. Well, let me say the States, okay? Because I have to be specific when I say America. There's life outside of the States. You are able to live a beautiful life outside of the States in other countries. You are able to have good health care, regardless if it's private or public sector, because as you can see, my cousin is in Spain and she had her baby in Spain in the public sector, and her experience was amazing. I had my baby in a private sector, and my situation and my experience was amazing. So I just want Black people, not even Black people, I just want people to just wake up, okay? Because I'm seeing more Hispanic people running, okay, to go to America, droves to go into America, and you're not realizing that American dream no longer exists, okay? The American dream does not exist.
It's not, no.
That doesn't exist, people. So if you know someone that knows someone that knows someone, be realistic with them and let them know. The American dream does not exist. When you go to America, you're going to have to work triple, quadruple time the amount just to even live and to I was speaking Spanish, to survive. Okay? If you can, I know everybody's situation is not the same as mine and my cousin, but if you can travel, explore, get to know people. You don't have to follow me on YouTube and my experience. There are tons of Black people and just people that are living in other countries, and they're doing the damn thing. And I think we as people, we need to be open to that. Understand that the world is bigger than America. America is just a facade. It's smoke and mirrors. What you see on TV is not the real deal, okay? People only show you the good things. You're going to see your friends who are there in America illegally pretending to you like everything is okay, and it really isn't. So it's important for you guys. What I would say the takeaway is to just be open-minded, do your research, get to know different people in walks of life. There are many people doing what we're doing. I'm not the only person. And yeah, so that's it. I just want to thank my cousin for, it's late and she's in Spain right now. It's like 1 o'clock in the morning and my girl got a flight. So thank you, cousin, for sharing this experience with me. Thank you, everyone who tuned in on YouTube, the people who tuned in on live on Instagram. I'm actually going to save this live so that you guys can watch it again for the people who couldn't be in the live right now. I know a lot of people always like to tune in afterwards and watch it, so it's going to be up. So thank you, everybody, for tuning into Big Girl TV. I love you guys, and thank you for your support. Okay, and we're out of here. Thank you, cousin.
Thank you for having me.